This call is now being recorded.
Hi everyone. So today we will continue our lesson in science Form 1, Chapter 4, 4.3, the menstrual cycle. So today we will learn about, communicate about the menstrual cycle and the sequence of change in the uterus lining during menstruation. And then we learn about relate the fertile phase of the menstrual cycle to the process of fertilization. And then the third, we want to justify the importance of personal hygiene during menstruation. Okay, so we will start our class today with a video. So I will share you this video from YouTube. The title of this video is the menstrual cycle. Okay, so I believe you can see now. And let me make it full screen and play.
Menstruation, also called having a period. As girls get older and their bodies change, they get their periods. The uterus is the part inside the body where a baby grows when a woman is pregnant. The inner lining of the uterus supports and nourishes the developing baby. If there is no baby, the lining is shed during her period. During a period, blood and other tissue from the uterus leave the body through the vagina. A period can last from a few days to about a week. You may have heard doctors talk about the menstrual cycle. This is the time from one period to another, usually about 28 days. Day 1 of the menstrual cycle is the first day of a period. The uterus starts to shed its lining. As soon as the period ends, the uterus prepares again to receive a fertilized egg. Eggs are released from a woman's ovaries. Eggs are super tiny, 1/10 the size of a poppy seed. Women have 2 ovaries, one on each side. The fallopian tubes lead from each ovary to the uterus. In the middle of the menstrual cycle, an ovary releases an egg. After ovulation, the egg travels down the fallopian tube. It takes a few days to complete the journey. Meanwhile, the lining of the uterus gradually gets thicker so it can support the development of a fertilized egg. If the egg gets fertilized, it will implant in the uterus and the woman is pregnant. If the egg is not fertilized, the woman is not pregnant and the egg will begin to dissolve. Because the woman is not pregnant, the lining of the uterus is not needed. A woman will have her monthly period, and the cycle begins again.
Okay, so that's a video as our introduction for today's topic. Okay, we will start our lesson using textbook. So I will show you the textbook here, chapter 4.3. Okay, so I believe you can see the textbook already. So this is 4.3, the menstrual cycle. Okay, so we start here. Women will undergo menstruation when they reach puberty. We learned puberty in 4.2 already. Okay. Menstruation marks the beginning of the menstrual cycle for each woman. Menstruation is the breakdown of the lining of the uterine wall and discharge of blood through the vagina. Menstrual cycle refers to a series of changes that occurs in the uterine wall and the ovaries. Menstrual cycle also involves the formation and release of mature ovum. Okay, maybe you can see here, the menstruation of a female will stop when she reaches menopause, which is around 48 to 55 years old. Okay, so continue here for the second paragraph. Menstrual cycle is controlled by the brain and endocrine system which secretes hormone. Normally, a menstrual cycle lasts for 28 days. One complete cycle usually 28 days. And it differs for each individual, sometimes different. Okay. There are various factors that affect the menstrual cycle, such as nutrient intake, abrupt change in body weight, emotional change, and mental pressure. Okay, so this figure shows the phases in the menstrual cycle. Let me make it smaller. Okay, so if you can see here, the cycle start from number one, number one until 28 days. Okay, and then we'll start again at one, continue, rotate, so that's why we call this as a cycle. This is a cycle, round and round and round, again and again, until menopause. Okay, so from this diagram, we can see there are four phases. There are four. The first is menstruation phase from day 1 to day 5, and then a repair phase from day 6 to 11, and then day 12 to 17 we call as fertile phase, and on day 14 there is a process here occurs, we call as ovulation. Okay, and then the last phase is the pre-menstrual phase, from day 18 to day 28, and we will go deeper about this thing in the next page. Okay, so this one, day 1 to day 5. This is the first phase we call as menstruation phase. The uterine lining breaks down, and this is this one, uterine lining. Okay, breaks down as menstruation begins and is discharged together with blood, darah, unfertilized ovum, and mucus, go out through vagina. This one. Okay, and then the second phase, day 6 to 11, we call as the repair phase. Uterine lining starts to rebuild, and thicken, menebal. Blood vessels, salur darah, in uterine lining are formed and ready to receive the implantation of fertilized ovum. Okay, you can see the diagram here. And then next, this is the third phase, we call as fertile phase, from day 12 to day 17. An ovum is released from the ovary on the 14th day of the menstrual cycle, or we call as ovulation. The uterine lining continues to thicken. Fertilization is likely to occur if sperms from male or from boy or from man are present. Okay. And then day 18 to day 28, we call it pre-menstrual phase. This is the fourth phase. The uterine lining continues to thicken and becomes richly supplied with blood vessels. Implantation of embryo is ready if fertilization occurs. The menstrual cycle will repeat if fertilization does not occur. You can see in the diagram here. Okay, this is third phase, and then this is the fourth phase. You can see the difference in this one. Uterine lining different. This is thicker compared to this one. Okay, and then next, importance of personal hygiene during menstruation. Personal hygiene during menstruation is very important to ensure the reproductive system is not affected with microorganisms like bacteria, virus, and fungi. How do you manage your personal hygiene during menstruation? How? Okay, so look on this diagram. Figure 4.16 shows the ways of practicing good personal hygiene during menstruation and their importance. Number one, during menstruation, a woman must change her sanitary pad 3 to 4 times a day. 3 ke 4 kali sehari to prevent the infection of bacteria and virus that might cause urinary tract infection, UTI. So this sanitary pad we throw in the dumpster, in the dustbin, tong sampah, not in the toilet, not in the toilet bowl, okay, not in the sink, but in the dumpster or trash can. Okay. Number 2, a menstruating woman is encouraged to bath frequently to clean her body. Mandi selalu, clean your body. Okay. So, this girl asks, what would happen if a woman experiences irregular menstruation? Irregular tu tidak tetap, tak betul. Not 28 days. Sometime 20, sometime 40, irregular. Okay. So, an irregular menstruation refers to a condition where a woman does not experience menstruation every month, has too long or too short menstrual cycles. Irregular menstruation might be caused by several factors, such as an increase in body weight, hormonal imbalance, emotional disruption, excessive exercise, and can also be caused by cervical tumor. Okay. And last, this one, irregular menstruation can cause negative effects to a woman's health. Some of the negative effects of irregular menstruation to women are: number one, infertility. Irregular menstrual cycle is an early sign of having reproductive system problems. A late treatment can cause serious health problems such as ovarian cancer, cervical cancer, and uterus cancer. Having difficulties in family planning, irregular menstrual cycle causes a woman to have difficulties in determining her fertile day, fertile day waktu subuh. Okay. Hence, it is hard to plan a pregnancy. Number three, health problems such as anemia. Irregular menstrual cycle can cause a long menstruation. This causes an excessive loss of blood. The body becomes weak and the woman faints easily. Anemia, kurang darah. The body becomes weak and the woman faints. Boleh pingsan easily dengan mudah. Okay, so that's all for today. We have covered 4.3. Okay, so now we will stop the recording. Okay.